Hi, everybody. It's Dr. Veronica, your holistic and functional medicine pharmacist, and I'm joined by Wynn Johnson, nurse practitioner at the One Family Clinic. And today we're going to talk to you about poison prevention and drug disposal because the DEA Take Back Day is coming up April 22nd. So be sure and look through your cabinets, find expired medications or medications that you no longer use, and get them out of your house so that they are not a potential source of poisoning for someone else. So, Wynn, can you tell us where else, if we miss this drug disposal day on April 22nd, what are some other drug disposal options that we have in town?
There are a couple of options. People can take their drugs to dispose of at the Sherman Police Station or the Albertson in Sherman.
So, Sherman Police Station or Albertsons, you can take expired meds and unused meds there. And you also have another option. If you don't have very much to dispose of at the medicine shop, you can go and purchase one of these Dispose RX kits. And this is a powder, and you add it to a prescription vial, and you add a little bit of water and shake it up. And it locks the pills in a jelly substance. Then you can take the label off of it, and this makes it safe to put in the trash can. I think it's important that we're offering people options for disposal that are not the regular trash. We never want to put regular pills straight in the trash or flush them down the toilet because we don't want them in our water supply, or we don't want them in the trash in a format where a pet or a child could get into them if they get in the trash, because that's a source of poisoning. And we want to talk about why it's so important to get rid of medications that you're not using or medications that are expired, because they are a source of poisoning. And they can also be diverted. If you have something at home like pain medicines, people who may be coming in to do work in your home, or teenagers' friends, they're looking in your medicine cabinets and seeing if you have anything that might be fun for recreational use. And things walk off from medicine cabinets. So unless you are actively taking a medication for a current medical condition, I would get rid of it. And if you have pain that's so severe that you suddenly need a very strong narcotic, I would suggest that you have that pain evaluated rather than self-treating at home.
Exactly.
Have you come across any poisoning cases in the clinic, or I know you have experience in the emergency room. Can you share any stories with us?
Yes. When I used to work in the ER, we have patients come in for poisoning almost like all the time. You know, sometimes it's this, people would, but usually it's a lot of time it's children get a hold of something that, they're not supposed to be around. And, that's usually the most, worrisome cases. A lot of time, it's adults and sometimes they overdose and things like that. So, I've seen a lot throughout my career, and it's usually, the sad thing is that some of that is very, very easy to prevent for them to happen. But I always recommend people to store their medication appropriately, and then like Dr. Veronica said, if you don't use your medication, then please dispose of, so that children or other people can get a hold of it and take them inappropriately.
Yes, I always recommend that my patients store their medications up high and in a cabinet, preferably that has a lock, or inside of a box that has a lock, just so that it's another method of keeping kids out of it. And if you can open lids, I recommend using the safety lids on your prescription bottles. We do offer easy open lids for people that have arthritis in their hands, or other issue that doesn't allow them to open those child safety lids. So I would say if you're able to open them, utilize them because they do help minimize the poisonings. Of course, they're not 100%. Kids are pretty ingenious and manage to find their way into things, but it can slow them down enough to hopefully buy us time to go, oh, you're not supposed to have that. I'm glad you didn't get it open yet. So use those safety lids or keep it under lock and key and keep things up high out of reach.
Absolutely.
And keep locks on your lower cabinets. I know we keep our cleaning supplies underneath the sink. And one time I forgot to relock the underneath the sink cabinets, and my son got a hold of something and sprayed it in his eyes, and we had to call poison control and find out what do we do, since we didn't think that it warranted the emergency room, but we knew we needed to do something. So can you share with us the number that we should call if we suspect a poisoning at home?
Yes, yes, that number is very easy to remember. So it's 1-800-222-1222. So basically 1-800 number one, and then I'm sorry, 1-800 3 number 2, and then number 1 and 3 number 2 again. So
Okay.
when I used to work in the ER, I had to call them all the time, and I just kind of remember that.
And
Yes.
don't be afraid to call them. I know me as a pharmacist, I did have another time where my son opened up a pill bottle and got a hold of something. He was fine. It was just vitamins, but you worry about the iron content in vitamins presenting a toxicity issue. In fact, the iron in vitamins is a very common thing that poisons kids. So thank goodness this vitamin that my son took didn't have enough iron to hurt him. But I called poison control and I had a lot of shame about it. Like, I'm a pharmacist, I should know better. He shouldn't have gotten a hold of this. And you got to take the shame out of it and call. And they are so kind and so helpful. So please call them if you have a poisoning situation. They're going to give you really good information and they're not going to shame you as a parent or tell you all the woulda, coulda, shouldas. They're going to help you through that emergency situation and tell you, ooh, this is serious. You need to go to the ER and have something like activated charcoal pumped in their stomach. That's sometimes a way that we deal with poisoning. Or they might tell you, oh, give them some milk because certain things that you ingest, the calcium in the milk will bind it up and make it less toxic. So there's things that they can tell you to do at home to manage the poisoning situation. And we want you to know that you have that resource available and it might save you a trip to the emergency room. And they're very helpful. So please call them. Tell us the number again.
Yes, yes, it's 1-800-222-1222. And I was told that the staff at the poison helpline actually was usually RN that have many, many years of experience and training to work in poison control. So that's why they have, they are usually very helpful and, very considerate of the situations at hand.
Yes, they have a lot of pharmacists that work at poison control too, and they receive some additional training in order to handle those urgent calls.
That's awesome.
Mm-hmm. Yes. They were at career day at my son's school, and it was kind of fun to meet a poison control pharmacist.
That is awesome. Yeah.
Yeah.
Of all the things, I can't imagine all the things that they have heard.
Yeah. And you don't always want to make someone throw up. I think sometimes we think, oh, well, you swallowed it, you need to get it out. And it's not always safe to have something come back up. Sometimes it's worse on the way out. And poison control can give you that information. Is it safe to induce vomiting or not?
Yes. Yes.
So, what else can we tell our patients about drug safety? We've got safe drug storage, safe drug disposal, and who to call if there is a poisoning situation. What else should we offer our listeners?
I would say that, read what the bottle said carefully before start taking them. Because I have a few patients who, we would prescribe something, but I think patient doesn't read, what the pharmacist wrote on the label carefully. So that they inadvertently take twice of what I need to take or something like that. So, that's always the thing I would tell my patient, read your label carefully, and just follow direction on the label.
That's a really great tip, to follow directions on the label. And I would add to that, if you're measuring a liquid medication, please use a syringe that you get from the pharmacy. Don't use a standard kitchen spoon or even the measuring spoons in the kitchen, because they vary from set to set. Use that, we call it a graduated syringe with very specific marks on it for accurate dosing. And that can help prevent poisonings in pediatric patients, because they're small and we need to be very accurate with their dose. And a kitchen spoon is not the best, most accurate measuring device for liquid medicine for kids.
Absolutely. It depends on the spoon that people look at.
Right? Yeah, some spoons are much bigger than others.
Exactly.
Okay. Well, I think that's all we have for you today. We hope that you stay safe, that you don't have a poisoning situation. But if you do, now you know who to call. You can call poison control, and you have the opportunity to take back any unused or expired medications with the DEA Take Back that's coming up April 22nd. Please go on the DEA website and type in your zip code, and they're going to give you lots of other additional locations for drug disposal if the one at Albertsons or the one at the Sherman Police Department are not convenient for you. And you've also got the DisposeRx packets that you can purchase from Medicine Shop if you have just a few pills that you need to get rid of. And please do not flush any medications. Did I leave anything off, Wayne?
You pretty much got it. Thank you.
Okay. Well, thank you for joining me today. And I hope that you'll join us next time as we bring you more Feel Good Friday tips and ways to keep your family healthy and safe.
All righty. Bye.
Thanks. I don't know where the stop button is. Stop. We're going to keep this because it's funny.